Sounds good. Hey, everybody. I'm Nick Latz. I'm the CRO at HST. Excited to be joined here today with Chris Pompilio, our senior sales engineer. And so we are going to walk you through our point of view on HST, on the ASC market, and how we've designed our platform and give you a sneak peek of what it looks like.
Yeah, thanks, Nick. Looking forward to talking to everybody today. We'll be kind of, as Nick mentioned, tag teaming this a little bit. I'll be running through the live demo and the second half of the call. And thanks for joining us.
Perfect. And looks like we're right at the hour. We can go ahead and jump in if you want.
All right. So in terms of table of contents, we are just going to start out, like we mentioned, walk us through a couple slides to set the context of how we think about the ASC market at HST and how that's informed how we built out our product platform. We will share a couple customer highlights and then jump into showing a little bit of the platform, as Chris talked about. And so to jump in, we are privileged at HST to have a really good vantage point into the ASC market. We have for a number of years. With roughly 1,800 ASC customers, we're having conversations every day with ASC operators and folks involved in the ASC ecosystem. And so that's given us a good vantage point into the market. And one of the things that we've seen from an industry perspective is that the ASC is different today than it was 5 years ago. And operating in ASC today is more challenging than even it was in the past. And there's a couple different reasons for that. One, from an external perspective, there's increasing competition and consolidation in the industry. There's more de novos coming online in the industry, driving competition. And there's consolidation and ownership changes going on in the marketplace. There's also every ASC has been impacted by rising costs over the last several years and reimbursements that don't always keep up with those costs. And then from an internal perspective, one of the things that's on every operator's mind is staffing shortages and staffing challenges, both on hiring as well as retention. And of course, higher acuity cases, which is certainly exciting for the industry, a big tailwind for the industry, but doesn't come without its operational challenges. And so what we're seeing in today's environment is that the most successful ASCs in our customer base are going through the process or have gone through the process of shifting from more of a reactive, let's drive case volume approach to more of a proactive, data-driven operation that they're using to manage their facilities. So what's that mean? Well, from a number standpoint, one of the things that we see is that the stakes for navigating this change from more of a proactive approach from more of a reactive approach to a proactive approach, the stakes are high from an overall operational perspective as well as a financial perspective. And if we look at this graph on the left, this is a graph of OR utilization. And what it shows us, looking here at the top, is that the average ASC within our customer base has about 56% OR utilization, where the top decile ASCs, the top 10%, have 76% OR utilization. So a 20 percentage point difference between average and top decile. And then if we look on the right in terms of what that means in terms of the impact and the flow through on profitability, the average ASC is a 23% EBITDA margin and profitability rate, whereas the top 10% is at 42%, so 19 percentage points higher, right? And so what that means is for if you just assume a $10 million facility, holding everything else constant, a top performer is able to generate $2 million more in terms of profitability and distributions to the bottom line every year. And so that's what we mean when we say when the stakes are high, really kind of the financial opportunity and the outcomes of the facilities both from a clinical perspective, a patient perspective, and a financial perspective, are really impacted by this proactive operations approach that we're going to be talking about. And so, what are the top performers doing differently? We shared how they're doing differently in terms of results from an OR utilization perspective. But what's going into that? Well, one, we're seeing that these top performers are no longer looking at just driving case volume. They're looking at the right case mix and driving the right case mix and being efficient in how they're managing their utilization of these cases across their facility or across these facilities. We're seeing that the top performers are looking at case profitability, not just after the fact with the traditional case costing approach, but actually looking at and estimating the profitability of each case at time of scheduling. So if there's a lower margin case or even an unprofitable case, they're able to look at what's driving that profitability and potentially fix that or review that before the case is being performed. These top performers are looking at all the inefficient touch points and operational steps and tasks that are still being performed manually in the facility and driving that out through automation and through best practice. These facilities are forecasting their hiring needs and their supply needs ahead of time and managing just-in-time inventory programs. And of course, they're benchmarking all the key aspects and KPIs of their centers, comparing those to benchmarks and using that to drive continuous improvement across the facility. And the benefits of that approach are really universal across the board to all stakeholders from an administrator standpoint, from a business office standpoint. These administrators and business office personnel are able to take those least favorite things and more manual, mundane things out of their day and focus truly on managing the facility and the higher value, more strategic parts of the job. The clinical teams are able to go from clerical work and being stuck in paper to focus on spending time with the patients and driving up patient safety and outcomes. And then physicians and shareholders in the facility, physicians are able to improve their quality of life, focus on medicine, and then the shareholders are getting better and better returns from this approach. And so that all sounds great, but not everybody's doing it. And as many of you know on the phone, there are things that get in the way from a day-to-day perspective. And those things that get in the way are common, right? It's, the facilities are often doing a lot with not quite enough staff members, not fully staffed. No one's got time in the day. And then secondly, the data and the organization of the data is often just not quite where we need it to be able to get the key insights out of the business and be able to drive the improvement opportunities out of those insights. Those are common challenges we hear all the time. And so those common challenges are a big part of what's driven us to build the HST platform the way that we have. And so we've put together an end-to-end ASC platform across the full life cycle of the patient experience in the full operational journey of the ASC. And so the platform spans pre-day of service, where we're helping with scheduling and communication and financial clearance on the front end. It's spanning through day of service, where we're helping drive the charting process and efficiencies from a clinical perspective, all the way through to the back end post-date of service, where we're helping out with revenue cycle management, inventory management, and of course the data and analytics that overlay the entire process. And we're going to kind of jump in and show you what this platform looks like. A couple of things to keep in mind as we go through it. What makes HST different? Where do we hang our hat? One is that we're purpose-built for ASCs. We don't serve other segments of the healthcare ecosystem. We're fully focused on ASCs. The second is that from a revenue cycle perspective and RCM perspective, we have the fastest time to cash in the industry. From an overall financial perspective, we provide proactive profit forecast at time of scheduling, so you don't have to wait until after the case is performed. We're truly an enterprise system, meaning that we allow uh, management groups or health systems or other parent companies to standardize the approach, standardize the data tables within their ASCs so they can standardize what those look like across their full network of ASCs. And with a standardized implementation and standardized approach, you're then able to look at apples to apples reporting as well as driving consistent best practices across all of your ASCs. And of course, world-class satisfaction and customer delight is something that's really, really important to us. So couple of examples just across the customer base that touch on the different components of our platform before we turn it over to Chris and start looking at it. One of the things that Pegasus called out was in their transition to eChart, the main business outcome or advantage that they were able to get out of this clinical transformation was getting to 100% complete on chart audits. That had been something that they hadn't been able to do before. And going digital on the charting side allowed them to get to that 100% mark. Urology of St. Louis, one of their key business outcomes was being able to look at the profitability of their cases ahead of time and take action on those cases that didn't meet their margin thresholds. And then Cascade Spine Center really getting advantages and improvements on the back end from a revenue cycle perspective, getting more visibility into their AR aging and able to act on that and drive down that AR aging and drive up that AR collection. So Chris, over to you.
Great. Thanks, Nick. Let me go ahead and share out my screen here and we'll get started. And as I'm doing this too, so our time is short today, but a lot I want to cover. So let me go ahead and share out my screen. Nick, you may have to stop sharing yours for me to do that here in Zoom.
Yep.
Perfect. There we go. And let me pick the screen I want to share. There we go. So I'll be going through at a fairly high level. As Lindsay mentioned in the beginning, I'm sure there are a lot of questions and comments out there. You can type them in the comment section. I'll make sure to leave time at the end, and I'll ask my counterparts to keep me honest here as I'm sharing out my screen. So do you see the HST home now on the screen?
Yes.
Okay, awesome. So I've shared the right place. So I'll go through at a fairly high level, but there's a lot of detail in here to cover. And we'll cover a lot of the stuff that Nick talked about a little before in there and how HST helps with that. HST is that end-to-end solution for our surgery centers. So we do have the ability today that when you log into HST, you can start out here in what we call HST Home, which gives you access to all the HST, almost all of the HST offerings in here. You can set up a single sign-on in here, so one login, and get to whatever programs you want to get to. I have a couple in here that I'll go through today. And then a nod to the enterprise setup as well. If you are set up that way, you can go through many of your centers in here. In my test database, I have quite a few that I can go into, but we'll kind of go through there. The home real quick gives you a little bit of a landing page with some metrics and dashboards in here. There are some additional dashboards we'll look at as well as to kind of what's going on with your center. And then also some what we call quick actions, which can take you right to those frequently used screens that as a user you go into every day. So not having to jump through too many hoops to get to the area that you want to get into work in there as well, as we're kind of going through. And I'm going to start out in the schedule, typically where that patient will begin in HST and how that looks when we're in here. So if I flip over to, I'm going to go to a different tab on my screen here today, but that would be available from that home screen that you're on to be able to get in here and view that schedule for your center. Again, you could view one or many centers. in here that you're looking at it. The idea behind these, the scheduling in HST, is you can also set up proactive notifications for one or many individuals as cases are being scheduled, as documents are being attached, as we approach that data service and the schedule changes and gets updates. So there's many different catalysts that can be an update to individuals. So you don't have to remember, oh, did we notify the sales rep, the vendor rep? Did we notify the physician, the anesthesia provider that we moved this case? Do we want them to look at that case today? There's a lot of proactive communication going on through here as well. There's also a little chat feature in HST, kind of a HIPAA compliant chat where you can chat with individuals about cases or just quick notes on information there as well. I'll kind of close that back out. But what some of that communication might look at, for example, if a case gets moved on the schedule, I have it set up, let me slide this over, where I get a little email from my center. That's one of my testing centers in my test database, but that a case has updated. And when that information gets sent, it is HIPAA compliant. There's a link right there to that case, and that will just land in your inbox. It can be an email. It can be a text notification to your phone. It can be a push notification to a mobile app for HST on your phone as well. So as those cases are being scheduled, the physician office can actually enter data right into the system. They don't get to control your schedule. Good thing about that, right? The surgery center still has that final say on there, but we can save time with that. The physician office has a similar view into the schedule here. They would just see their cases. That's important, obviously HIPAA compliant across the board. But the takeaway from this is everybody is looking at that same case, right? So there's not disparate pieces of information and, a PDF of that booking sheet that came over and is sitting in somebody's inbox, or a printed schedule that is out of date. You can, of course, print schedules out, but as we're looking at cases here, everybody is looking at that same case and seeing that information in here. And again, you can flag individuals to review the case for certain aspects. If you want anesthesia to review it, they can do that as well. Some of those can be automated when you're in here. And just on the schedule itself, typical schedule view, but I can also view things in here as kind of a case list. So again, if I'm looking at my cases on the schedule today, maybe it's across all my organizations or just one organization if I am an enterprise setup in here, or maybe just one or more physicians. You can pare down how you're viewing things in here as well. And like I said, it's really this similar view for the surgery center or the physician office. The main difference, if a physician office was viewing, again, they're just seeing their cases in here as they're looking at those. And we're kind of moving through here. So a lot of great proactive communications from here. And again, once you're in here in HST, you can easily get back and forth between your other centers in here with the little menu as I was in home earlier. So there's ability to go from here to those cases and then back to home or back to the other centers, other apps from what you're in. And we'll go through a couple of these a little bit today. But I'm going to keep moving forward, and I want to talk a little bit about kind of looking at a case now where, again, all trying to do is proactively. What is the feasibility of doing that case from a financial standpoint? Many centers today have maybe an individual, or maybe they plug some numbers into a spreadsheet that can look at the schedule and go, yes, those cases are good to do, or no, we may not want to do that case. With HST Forecast, and again, part of that same kind of single sign-on login, you can automatically view cases on your schedule and see if those cases are going to be profitable or not. And if there's some flags on those cases. In my test database, most of my cases look pretty good, right? If that profit was on the case, I'd love that. You can also build in cost assumptions in here. The system can pull in cost directly from historical cases in HST. And if I clicked on one of these cases, it would show me in here what that revenue forecast is going to look like based on my historical cases, based on my historical contract rate or payments on the last cases. Some of those costs can be coming right from HST, calculated from the staff on the case, from supplies used on the case. I didn't set up a lot of overhead costs in my system, which is why my profitability looks pretty good. But you can see that information there, see details on that case, and also for that physician for that day, what his full day looks like or her full day looks like. And if you want to see some of those case details in here, this is what we're doing. If we verified the insurance or completed the authorization yet, if we needed to, and what those flags may be. So the system can identify those flags for you, show you those cases that may be unprofitable or potentially unprofitable, and have you make that informed decision if you are going to be doing those cases or not. There are also some great dashboards in here as well. Just looking forward based on what's on the schedule for the next 10 days, next 30 days, what that revenue looks like by physician, by procedure for your cases, the revenue by OR minute in here too, or by payer, and some additional dashboards in here you can kind of look at across the board as well. I won't go into a lot of the detail in these, but you can look at revenue or cost or profit on those cases in there, and also kind of see if we are declining some cases or approving cases, what that loss avoidance may be in there as well. So a lot of configuration here that you can do. You can set this system up to automatically flag you for cases based on that profitability, based on implants, based on potential revenue for those cases. And again, nothing has to be done extra in here once it's set up. It's just automatically identifying those cases on the schedule for you as you're going through there and pulling that information in. And coming in here to the different products from here. But once those cases are on the schedule, right, we've kind of looked at those. Yes, we're going to do them. We're gathering information from those patients. There is also a patient communication in here where you can come in to the HST patient engagement platform. This is outreach to the patients with an online pre-assessment that they can fill out that can pull right into our charting capabilities in HST as well. You can view a queue in here. These will be patients on my schedule. If they have completed their and submitted their pre-assessment form, if it's in progress or they haven't started it yet, it also allows me to come in here and communicate with that patient. Maybe I need to resend that form out to them. I can. Maybe I need to review their answers in here that they gave me. I can go through that. This would be the form that they filled out. 100% customizable for those questions in here that you're tracking on that patient, and what they pull in there, allergies and medications they can enter in as well. And all this information can pull through from here. They would automatically get that link to their pre-assessment survey as they're scheduled. You can determine the timing on that. So if it goes out when they're scheduled, if it goes out 7 days prior to their case being on the schedule, if they get a reminder if they haven't filled it out yet, you can set that up in here as well. You can always send it on the fly. If you're looking at a queue here and you notice that they haven't completed it yet, you could go ahead and open up that patient like Josh here, and I could go ahead and resend that survey out to him from here. You can have multiple surveys. It can be both pre and post surgery, sending surveys out to the patient in here as well. And again, those surveys are customizable. Survey, questionnaire, pre-assessment, I kind of use those terms interchangeably. But it's basically a way for the patient to fill out their information as they're moving through here. Part of that patient outreach or patient engagement in HST is also the ability to customize and target messages at those patients, messages about their data service coming up and their procedure. I opened up one little message in here before that I kind of set up. This one goes out to all my patients 3 days prior at 9 a.m. And it's just a quick reminder about their case on the schedule. You can pull in specific data fields from their case. So it is HIPAA compliant, and they can opt in and out of messaging, of course, but this gives them the ability to have this automatically send out to them with information they may need about their case. You can set up additional send rules, not just the time and date it goes out, but maybe it only goes out to certain patients based on physician, based on anesthesia, based on the procedure description. You can do that as well. And the patient can also respond back in here. If they do respond back in the way you expect, you can give them an auto response back based on their text back into the center. They can also always just get an automated response, so that this is a self-perpetuating system. When they are getting the patient is getting the right message at the right time based on aspects of their case that you configured. And if they are responding back in, they're always going to get some sort of response. It could be specific to their response back in. It also could be just a generic response to that patient. And then there is the ability for you as well to kind of follow up with those. If they are sending information back in, you can click on that patient and see all the messages they received. And you can respond back to them in here with a free text message or a template that you may have in there as well for them, and an easy way to communicate with that patient if they do want to opt into that messaging. So another great way to keeping the communication going between, we talked about the individuals at the center, but also the patient themselves. All right, I'm watching my clock here, and I'm about a minute behind where I wanted to be. So let me quickly flip over to HST eChart, also browser-based. It is device agnostic. It sizes itself best to a touchscreen tablet, but you can use it on any device you want. All those patients on the schedule that we saw earlier that came in are all going to be in here. The system knows exactly how that chart is set up based on the preference card for that case. So for example, if I bring up a preference card for Dr. Tisdale for her knee arthroscopy, all the items that are used on that case, where those items are used in the system, is it pre-op, is it intra-op, is it anesthesia, and how that chart is set up, what chart we're going to use, those physician orders, anesthesia orders, discharge instructions. You don't have to do this for each case. It's already set up. That's just how the system knows, so that when you schedule a case, the chart is ready to go. When you click in here, you can see information about those patients, what's going on from here, what anesthesia type is being used, where they are in the surgery center, if they've completed that form in here, or if there's other things needed on that chart. You can see that from here as well. There is a patient locator in here that you can see as well, what's going on with my patients today, where they are in the center, who brought them in, how long they've been there in that area. You can jump to the patient from here. There is also a front-facing one of these that you can have up. I had it set up in here. There we go. Where you may have this on a lobby out in the front, right? When you can see what's going on with the patients, it'll update real time. If the patient checked in, we're ready for them to check in with the front desk. A patient's in pre-op, they need their glasses. So asking their family member to come bring those glasses to the nurse. You can see that information in there. Again, all that is updated real time when you're in here. And when you're charting on your patients in here, if I go ahead and click on Hannah here, for example, it'll take me into that patient's chart. In here, the way the charts are set up is they're divided up into the workflows of the surgery center, from the pre-op and registration information to the intra-op and anesthesia, the physician workflow. Everybody has their own workflow in here they can go through. You never have to enter data twice. Multiple people can be in the chart charting away at the same time. You're never stepping anybody else's toes. It's saving as you go through here. So as you're walking through, maybe the consent in here, the patient can sign right on the tablet, and you can sign as well on the physician. That things like that room in time, we interface with the vitals monitors. Each section of the chart may have one or many different blocks of information in there. We call them blocks because if we think about them as building blocks, you can stack them anywhere in the chart that you want to. Many of them are going to appear in more than one area. Allergies, for example, the system is always doing a med and med allergy check for you as you in here. And to tie this back, you always track to your percent complete in here. So as Nick was mentioning, one of the stories, one of the things they loved about this is being able to track that completeness of their charts. There is in here the ability to look at each patient individually, or from a standpoint at the end of the day, or at some point, maybe the end of the week here. Today, for example, I may come in here and say, show me this week any open charts that are incomplete here that anybody charted on. And there's a list of them. So no more going through and putting sticky notes on the charts. This is what needs to be filled out. Individuals see that as well in their task manager as they're in here looking through things. I have quite a few. Mine's going to take a second to open up because in my test database, I do this and I don't ever complete my charts. But there's a list of all the things that we're doing. From an admin view, you can see everybody's tasks in here and what they haven't completed. If a user doesn't have anything else to complete, like Lou here has completed all his information, they're going to get a little trophy. They're all caught up. So the system's proactively tracking that information for you as you're going through there. I think the trophy is a good place for a Friday to kind of end this on and make sure that we have a little time for some questions. I know, Lindsay, you've been monitoring the chat, if any, in there, but I will stop talking and see what kind of questions and comments we have from the folks out there.
Yeah, you did a great job hitting at the high level. The first question that came in is around inventory management. Can the system process inventory management?
Yes.
That was a quick answer. Do you want to expand a little bit on it?
Yes, sure. So when I was in the preference card screen earlier, right, all those items in here are coming in from the item master in HST, or we do partner also with third-party inventory management systems like iOS. This would be the iOS item master in that case. And then these are all pulling to the specific places in the chart when nurses are decrementing the items used, and with a one click in the chart, that's sending the items usage information back into the system. So we're keeping track of that inventory quantity on hand. There are reports you can run for case costing. That's where that case costing will start from for the profit forecast we were looking at earlier as well. You can do physical counts, purchase orders, receiving out of HST as well. So yes, right was the answer.
Perfect. And right on time. Thank you so much, Nick and Chris. We will share any additional questions offline and follow up with the answer to that one so everybody has a copy. And as a reminder, this will be recorded. We'll send it out to you, and we upload all of these onto YouTube as well as other demos if you're ever interested in learning more. Thanks. Have a great one.